Live from the Washington, D.C. area, it's the Inside Scoop. All the news that our viewers want to know. Now, here's the host.
Hello and welcome to Inside Scoop. I'm your host, Morgan Jameson. Today we're joined by a disabled Latina activist, Alex Dixon. Alex, thank you for joining us today.
Thank you, Morgan. Nice to be here.
I'm so glad you are. I know that you've previously served in roles on the other side of these productions, so really glad to have you on this side and sharing about your passion for healthcare and healthcare access. For our viewers, though, would you please share with us the identity behind how you are self-describing yourself as a disabled Latina activist who's passionate about healthcare? Why is that important for you to say it like that?
Well, because with the name Alexandra Dixon, nobody thinks that I'm Latina. So I need to be very intentional and very proud to claim that as my heritage, as where I came from, what influences my worldview, that sort of thing. And I call myself disabled because it's an integral part of my identity. There's a big kind of conversation happening in the disabled community if you say that I'm a disabled person or I'm a person with a disability. And I like to say I'm a disabled person. And I'm an activist. Have been an activist since I was very, very young, probably first grade. So, those are the three really important identities for me.
Okay, thank you for sharing that, especially in the space that you are filling as an activist, trying to balance, those cultural, social, and, the other pressures of norm, right? Of what does this mean? So thank you for sharing that with us because, who we are is important in how we express that. You mentioned you are very passionate about healthcare issues. How long have you been passionate about healthcare or working or volunteering or being an activist in that space?
Essentially since birth. It wasn't until a few years ago that I could take a breather and not worry about having a pre-existing condition. I was born in 1982 with a disability called Spina bifida. And I was born in Bogota, Colombia, and people, the doctors there said, having this disability, take her to the States because the kids here don't survive in 1982. But in the States, they are surviving. And so my parents said, great, where do we take her in the States? And the doctor said, Chicago, New York, DC, and there's a tiny little town out west called Salt Lake City, Utah. Well, Dad happened to be from Salt Lake City, Utah. And so we went to Salt Lake and I got really good medical treatment there. But my mom, as a Latina, experienced a lot of rejection and discrimination and said, I'm not raising my child in this environment. So we came to DC when I was 4. And I've really cared about access to healthcare because my mom is a very highly educated person. And when I was born, she thought, oh, it's just going to be one surgery and it's going to be over. She had no idea what spina bifida was. The doctor used the big scary word of myelomeningocele, which is the medically accurate term. And so I think about the Latinas who don't have the privileges that my mom has in terms of education and that sort of thing. And so how do you help them when they get told that the baby that they've just had has spina bifida and they have no understanding of what that is and they don't have the resources to be able to go look that up? And, and if you Google spina bifida, you get really scary stuff on the internet. So my passion has always been there to particularly help the Latino community. October is Spina Bifida Awareness Month, and Latinas are at 30% higher risk of having a child with a neural tube defect than are other women. Part of that is access to abortion care. And right now, one of the things that we're seeing in Texas is a near total ban on abortion at 6 weeks. And it's a very complicated and messy and painful issue for a lot of people, but I am definitely here for letting pregnant people make the choices that they need to make to keep themselves healthy and safe. And so that's a lot of where my passion comes from in doing this work around healthcare access and reproductive justice and making sure that people have the information to make the best decisions that they can to live as healthy a life as they can.
That sounds like it is extremely personal to you, and taking that on not just to work or to overcome obstacles that you or your family may have faced or are facing, but rather taking that and saying, I'm not a selfish person who is just here to help myself. I really commend you for that. And again, thank you for sharing with us, Alexandra, my apologies. When it comes to our region, Northern Virginia, specifically Fairfax County, I know that you have some background in working in healthcare access professionally. Between registering or signing people up for the ACA and, getting people enrolled and, everything you're doing around COVID right now. I see your posts on social media, and you are very much, here's what you need to know. And, here's some resources for you. And that's really why we wanted to have you on the show. But when it comes to our region, specifically, Northern Virginia, Fairfax County, what are some of the top 3 or 5 issues that you would consider to be things that are being worked on, or need to be worked on to, sum up what you were saying before, help our entire community, not just, small subsets? What are some of those top issues?
I'd like to see universal health care, period. You're a human being. You have a body, you're going to get sick. It shouldn't cause you to go bankrupt. You shouldn't have to worry about, how do I afford my medicine? How do I afford food? How can I keep a roof over my head? We should have universal health care, period, for everyone. No exceptions. That's the number one thing I think that we need.
Are there any other issues that are pressing in the area? And when I say healthcare, I mean broadly, right? May it be primary care, mental health, specialists, dentistry, even orthodontia. When we talk about that access and some of those inequities, what are some of the ones, short of universal healthcare? What are some of the issues that are currently being worked on to address some of those inequities, or that should be worked on to address some of those inequities? What are you seeing on that ground level?
Yeah. COVID taught us who we as a society consider disposable. And 1 week it was the Latinos were dying more. 1 week it was African Americans were dying more. And I don't think any of us are disposable. And one of the things in doing COVID outreach that I've learned is that it's not just about the vaccine. It's the ways in which the government has failed marginalized people over and over again for decades. It's not just Tuskegee. It's stuff like, I can't get the government to give me clean water. So how am I going to trust the government to give me a safe vaccine if the government can't even give me free or clean water? I think that's important to know, that it's not that there's a lot of stuff being said about the vaccine hesitant folks. And in what I'm seeing in my community, it's a lot of trauma related to racism and to historical inequities, but also more current stuff. And that's causing my folks to not want the vaccine.
I'm just going to circle back for a quick second. When you say that, there are other inequities or lack of trust, if the government can't, get me clean water, in what world am I going to trust, a vaccine? Are you saying that these issues, are multifaceted in the sense that, there's intersectionality, or what does that mean, if the government can't get somebody clean water, but they can get them universal health care? Are we going to be receiving the same hesitancies?
I don't know, because I can't look into the future with that. But what I'm saying is things that don't seem like they're related are interconnected. I would have never have made the connection between not being able to get clean water and then having vaccine hesitancy until somebody pointed it out to me. So it's one of those things where these systems are not set up to help people now, will impact later on what people are willing to trust.
Okay. So you mentioned that there are, minority communities that were, quote unquote, who is disposable this week. What efforts or mitigation there in, let's go back to vaccines for this, but what efforts or mitigation tactics were used to curb some of the disparities and inequities? Were there, things like off the public record, vaccine centers or pop-ups, or, how was that being addressed, or what do you know, or what did you do to make some of those things better for the community?
I think that it's critically important from a public health point of view to have someone from the community giving the message to the community. To find your kind of community spokesperson, your trusted person, and then have them go and tell their friends. Word of mouth is very important. Someone who speaks the language, understands the culture, and is going to show respect. It's really easy to write people off as, oh, well, they believe this, and this is silly to believe, so I'm going to write them off because they believe such and such. Whereas when you get someone to sit and at least listen to people about what their concerns are, it's definitely helping to make people more comfortable with getting any kind of medical care.
Okay, I see that, and I hear that loud and clear. A little bit of my background goes back to the town crier, the hear ye, here's the information. But that person also had to talk to various leaders within the town to display that, or to disperse that message. So what steps were you taking, or not even you, that were being taken to have some of those community leaders with a trusted and respected voice go out into their communities, and may it be vaccines or healthcare broadly, what do you know that's being done to help that that access and knowledge and sharing of power?
Yeah. So there are vaccine events that are being done in the neighborhoods where people live, and it's getting the message out that this vaccine, for especially COVID, is a free vaccine. You don't need health insurance. They're not going to ask a ton of questions that are going to then be a barrier for you to come get the vaccine. If they're going to ask questions, that's going to be about health and do you have allergies and that sort of thing. And those are legitimate questions to ask that actually do impact your ability to get the vaccine.
So you say neighborhood locations. Does that mean, I recall Fairfax County saying, this community center or that, area or this or that. When you say neighborhoods, those aren't some of the places that I'm hearing of. Are you saying that there was intentional effort being done to bring vaccines to neighborhoods for that neighbor to neighbor outreach?
Well, obviously you need medical professionals to give the vaccine, but I know that Fairfax County is working very closely with the churches and the faith communities to get the vaccines into the churches, which is a trusted area that people can go. I know that Fairfax County is working very closely with other nonprofits in underserved areas that people already get services at this nonprofit. And so therefore people trust that nonprofit and can walk to that nonprofit. So there's not a transportation issue and can get the vaccine there.
Okay. So Alexandra, I'm sorry for our guests. Alexandra and I have known each other for quite some time, and I met her as Alex. So I am intentionally retraining myself. So bear with me if I misspeak, and apologies to Alexandra if I continue that. However, Alexandra, what are some of the common misconceptions, broadly speaking here? What are some of the common misconceptions people may have when they paint that mental picture of healthcare disparity? Is it, people are poor or, less fortunate, or, they choose not to have health insurance? What are some of those common misconceptions? Is it language? What are some of those things that people may have when it comes to healthcare disparity?
I don't know that there are misconceptions per se. I think that people don't realize the healthcare disparities. When I was talking earlier that Latinas are 30% more likely to have a child with a neural tube defect, you kind of had a surprised look on your face. That is something that is not well known. In Fairfax County, when we talk about not just health disparities, but poverty in general, Fairfax County has the reputation of being one of the richest counties in the nation. And yes, that's true. And yet we had almost 2,000 people who were unhoused when we went and counted them in January. And people are very surprised to hear that about Fairfax County. And having being unhoused is a healthcare issue. So I think people think that it's like that we're doing better than we are, and don't see where the barriers are and don't see where the disparities are.
Okay. Do you think that part of that is intentionally turning a blind eye, or just, I don't want to say ignorant in a disparaging way, but, do you think it's intentionally turning a blind eye, or people just only know what they know and don't know some of those things?
In some cases, it's intentionally turning a blind eye. But I think that in some cases it is people don't know what they don't know. I myself didn't realize we had 2,000 people who were unhoused until I started doing a hypothermia shelter years and years ago with my faith community. And then that got me into thinking about homeless and healthcare and that sort of thing.
Okay. So, a little bit is just not knowing. And part of it is choosing to not know, or choosing to not scratch the surface. Do you think that is something that distinguishes you as a community leader and an activist, that when you see something, you're genuinely curious? If please don't let me project, but if not to solve something, but to better understand it and have a better growth of that understanding?
One of my friends says to me as a complaint, Alex, you never turn away from the ugly and the horror and the trauma and the pain. And I think that's kind of important, because I think it's easy to turn away. It's easy to turn a blind eye. It's easy to shut down. It's easy to get overwhelmed, and to say it's not my problem. And it's easy to say it's not my problem and then not take action. And I'm definitely the person, and I've said this many times to my board of supervisors person, I will fuss at you, I will complain at you, I will tell you that there's a problem, but then I will also offer a solution, or I will offer to be part of the solution, if I don't know.
Is that the differentiating factor? Not just the knowledge, but the differentiating factor is, what can we do to fix this, without necessarily asking, but looking, getting involved and making suggestions? Is that what differentiates you from being informed to being an activist?
Yes, it's the taking action. The word act is an activist. And so activists take action.
Okay. So do you consider any level of action, may it be, behind a keyboard on social media, or, out there escorting people to clinic visits, is there anything that is more or less important in the world of being an activist when it comes to healthcare?
No. People are going to be able to engage in different ways at different times, especially people with disabilities, especially folks who are chronically ill. They say, oh, it's just keyboard activism, but it's the informing, it's the telling of our stories, it's the bringing awareness to what's going on in our lives as disabled activists that then gets other people activated, who can then go and write the letters and advocate and protest. People say, oh, well, you're just sitting behind a computer all day. But that education and that knowledge sharing and resource sharing is as important as showing up, and recognizing that there are going to be times that I can show up, and there are going to be days when my body says, nope, you cannot show up today. And so finding other ways to be engaged and provide support, information, and resources to keep the ball moving forward and keep things in people's minds is as important. So I don't do a hierarchy of being in the streets is better than posting on social media. Both are important and needed.
Sure, absolutely. Sounds like there's an entire ecosystem, including, those both volunteer representatives and, advocating for communities, or voluntold representatives for advocating for communities, as well as elected officials, right? Like all of that pulling together of, who is advocating versus who's being an activist. And, I think that that's a clear indication there to say, one must take an act, one must do something, but that universe and that ecosystem is, all vitally important. There's no one thing too big or too small, or limiting or otherwise that somebody can be doing. So I hope that, some of our viewers to this program get inspired and, realize that it's not a huge commitment to be involved, and not a huge means to become an activist. Based on what Alexandra said, it is about taking an action. Call somebody, tweet, use social media, knock on a door, give somebody a bottle of water. Right. You see an activist somewhere doing something and you can't stop, and you can give them a bottle of water. Alexandra, we're coming up on our break here in a few minutes, but, to that end, do you want to say anything to our viewers about, don't be afraid to get involved?
People have asked me about courage, and as an activist, they say, well, aren't you scared? Of course you're scared. Of course you are. But I kind of see courage as a muscle, and it takes courage to tell our stories. And it's emotional labor, and often the emotional labor of telling our stories doesn't get the respect that it deserves. And especially the emotional work of checking in on other activists. Sometimes I can't be on the front lines, but I can check in on another activist and say, are you okay? How did that action go? Do you need to decompress? Can I buy you a meal? That sort of thing. That is a form of activism and community care and building the world that we want to live in that is every bit as important as being out on the streets. And there's a million ways to pop in and get plugged in and that sort of thing. We don't always have to be on the front lines. And sometimes it's more powerful to be behind the scenes.
That's really fantastic. Every action counts, really and truly. So thank you for sharing that and for opening up about not just yourself, but also how others can get involved in some of the things that we should be mindful of when it comes to healthcare disparity and healthcare access, broadly speaking. So, really do appreciate you taking some time to share that. And, after the break, we will discuss a little bit further about some of the resources in the community, as well as, some of the things that people just need to know about healthcare disparity across the region, and specifically in Fairfax County, and also what they can do to get involved to bring about a change. So to everyone who's been watching thus far, I hope you stick around for after the break.
As they head toward the finish, Warren has built a substantial lead and headed for her 4th gold medal.
She's ahead of the world record pace by at least half a second, and oh, wait, what's she doing?
I think she's doing a headstand. Why would she do that?
She's stopping. She stopped.
I've never seen
She was so
anything
close
like
to the
this.
finish, and she stopped. I mean, this is unbelievable. Yeah, I've never.
Nice going, Spencer! I can't believe we broke Old Man Hennessy's window.
Correction, dude. You broke. I just threw the ball.
This is really bad. What are we gonna do?
We?
Go to the door, ask for the ball back. Are you serious? It's my ball, Myrtleback. You're so dead. I'd run away. Yeah, to Uruguay. Kiss your life goodbye. Sorry.
Let's go.
Yeah.
Remember me and your well.
Nice one. Some friends you are.
Keep smiling, keep shining.
Hi. Tell him it was an accident, and we can fix the window. Come on. I'll come with you.
Loyalty. Pass it on.
You go first.
A message from the Foundation for a Better Life.
This is firstgov.gov, where we're obsessed with getting you government information.
Brand new student loan applications on the site, baby. This calls for a celebration. Where's your uncle?
So in the end, it was either take the astronaut gig or come work here. What can I say? Duty called.
Dude, that's my cop.
Oh, sorry.
Yeah. No, I'm pretty sure that's Sam's cop.
Oh, sorry.
Yeah. No. Sam's? No.
Just log on or email us and get what you need.
C, change of address form. That's how it's done.
D, driver's license renewal.
E, emailing Social Security information. Yeah.
Okay.
Yeah. Nice, we'll allow it. All right, Ed.
What are those?
Government surplus cars for auction.
You posted those online last time.
No, you did.
I'm posting them online this time.
For all your government information, firstgov.gov.
Your blood pressure numbers could change your life. Talk to your doctor about creating a plan that works better for you. Start taking the right steps at manageyourbp.org.
Dare to load their minds. Dare to explore. Dare to STEM. Learn more at She Can STEM.
We're back to the Inside Scoop. Here again, your host.
Welcome to Inside Scoop. I am your host, Morgan Jameson. We are joined by a disabled Latina activist, Alexandra Dixon, on the show. Alexandra, thank you so much for joining us.
Absolutely. Thank you for having me.
I'm so glad you didn't run away when we went to the break. This show, we're talking a lot about healthcare and healthcare disparity. And in this half, I really want to get into ways people can get involved in our community here, some of the resources if people want to take up that first step of activism and start to share those resources with other people, as well as a little bit more about you. So let's just jump in and get there. First and foremost, though, before we get into our conversational discussion, is there any one thing that you want to take a moment to use this platform to share with our audience, about what we're talking about?
Yeah. In Congress, there is the Women's Health Protection Act. And this is going to help women to get access to all kinds of healthcare that has been difficult to get passed. So definitely call your congressman about the Women's Health Protection Act.
Well, there we go. Alexandra, when you describe yourself as a disabled Latina activist, mm-hmm. you mentioned earlier what that means to you and why it's important to speak to your identity. What does that mean for you, and how does it portray, when you think of these identities, how does that play out in the world when you are, being an activist, when you are out there advocating for healthcare? Are there any obstacles or microaggressions or, things that you can do because you are you? Tell me a little bit about how that impacts you in the work that you try to do.
Sure. So one thing that's real important for me to always remember is that I'm a white Latina, and that confers privilege to me both here in the States, but also in Latin America. And part of one of my privileges is that I've been a U.S. citizen since birth. And so it's important to center the most impacted in certain spaces. And when it comes to healthcare, if you are undocumented, healthcare is very, very difficult to obtain. And so I always want to lift up my undocumented comrades and just give them a lot of love and support with that. And one of the things as an activist that can sometimes get tricky when they don't know me is that people will underestimate me. They'll be like, oh, she's just a poor little disabled girl, right? And then they meet the powerhouse that I am, and they can kind of be blown away. And not so much anymore because I'm known in the activist community, but every once in a while you get are you sure you can do that? And it's like, yes, I'm sure I can do that. One of the things that definitely happens is that non-disabled activists will talk about, oh, it's only a 5-minute walk. Well, that's a 5-minute walk for you as a taller person, as a non-disabled person. Don't tell me 5 minutes. Tell me, oh, it's a half a mile walk, because then I can gauge whether or not I can do it. But yeah, you underestimate me at your own peril. And it sometimes is my advantage, and sometimes I use that.
I hear you loud and clear. I have, over the years, getting to know you, have learned many of those things, either firsthand, observationally, or secondhand. So when you say powerhouse, that's exactly how I would describe you. So thank you for sharing that with us and letting us know that, the way we talk about things, it's a 5-minute walk versus, distance, wherever we, come from and wherever we are, that some of those preconceived notions are just the way we approach things. We might need to look at through a different lens and, say or communicate in a different way, to ensure that nobody's getting left behind and that everybody understands. And that's definitely a big thing that I have learned from you over the years is, it's that, the description of, what does it mean to, be a fool, and it's doing the same thing over and over again, expecting a different result. Right. And, sometimes that does come down to the way we communicate with people or communicate things to people or for people. And I think that is something that you absolutely do an amazing job of, is thinking of those broad ways to make that happen. So earlier we talked about some of the potential misconceptions or misunderstandings of what healthcare disparities are. I'm curious, in your thoughts, who among us in Northern Virginia, Fairfax County, who among us are the most vulnerable? Who need the most help?
I'm hesitating in answering the question because it kind of feels like the oppression Olympics. So who I'm focusing on, who gets left behind. And one of the things that this pandemic has taught us is that the things that they told us that we couldn't do for years and years and years, we can actually do. One of the things Fairfax County did, and I'm so proud of them, is that they housed all their houseless folks and kept them safe during this pandemic. We ended homelessness in Fairfax County. We bought hotel rooms for people to be able to stay in, to stay safe. If we can do that during a pandemic, when our tax revenue was down, we can do that once this pandemic is over, and we need to keep pushing. That's one of the things that I learned from this pandemic. One of the things that I'm focused on as an activist right now, from a healthcare perspective, is the eviction crisis that is going to hit and is hitting. People losing their homes, people being kicked out, is going to cause enormous amounts of suffering. And we really need to have a laser focus on that as a community, as a people. We need to keep focusing on homelessness issues. One of the things that I know as a disabled activist is that the disability puts me at huge risk of being homeless, because with a disability, if you can't work, you're at extreme risk of being homeless. And it's one of the things that it shouldn't be like that. And it shouldn't be that the answer is, well, then we're going to put disabled people in institutions. People with disabilities should be able to live in the communities of their choice and that sort of thing. But the interconnection between capitalism and homelessness and disability and productivity, and that's our only worth, is what we're able to produce. That's a very, very scary intersection for a lot of people with disabilities. And
I can only imagine.
And it takes one illness in the United States for you to end up possibly losing your job, losing insurance, losing your home. It should not be like that.
Alexandra, I'm probably going to get this phrase wrong, so please correct me. There is a difference between a visible disability and a hidden or conversely invisible disability. And I think personally, a lot of times, many people focus on what they can see, what they can touch. But, you talk about homelessness, and I'm by no means trying to grossly over exaggerate here. There is a component of being homeless that either leads to or is caused by mental illness. So I hope that I am not speaking out of turn on that. You are clearly the activist here, but I can definitely see how, treatment can help, medical healthcare treatment can help people, reduce or end, their cycles of poverty or homelessness or whatever. It might not be poverty, it might not be homelessness. There are people who don't have access to mental health services. Right. So, what are your thoughts on that notion of invisible or visible disabilities or otherwise? And again, I apologize if I'm misstating that or speaking out of turn.
You're not. We know that 75% of the homeless community also have a comorbidity with some sort of mental illness. So you're absolutely right about that. In terms of invisible disabilities, I'd like us to be more sensitive to it. Many of my comrades get a lot of not nice things said to them. Why are you using that parking space? That's not for you. And it's like, I have an invisible disability and I shouldn't have to tell you that. I shouldn't have to justify my disability. A lot of my comrades with invisible disabilities often have to prove that they're disabled enough. And that is not a healthy thing. I'm not here to police people's identities. One of the things I'd like to see Fairfax County do is go back to looking at housing first as a way to ensure that people with mental illness have stable housing, because without stable housing, dealing with mental illness is much more difficult. We know from study after study after study across the nation that housing first as a model works, where many times we say, oh, well, people have to get clean and sober first, and then they can get housing. But it's actually backwards. We need to get them stable housing first, and then work on helping people get clean and sober.
Absolutely. I mean, follow the evidence, follow the information, and, hopefully find a way to make that happen. For our viewers at home, we have had a series of websites and phone numbers at the bottom of the screen this evening. These are just a few of the resources in the community. Alexandra, can you speak to what these resources are at the bottom of our screen, and let people know how they can utilize them to either help themselves or potentially take that step of activism to help others? Would you mind sharing with us?
Yeah, so Fairfax County has two nonprofit community health centers. One is HealthWorks for Northern Virginia, which, spoiler alert, I work there, but I'm not here representing them. And the other one is Neighborhood Health. And so these are health centers where people can go regardless of whether or not they have health insurance, regardless of ability to pay. And they offer comprehensive primary medical care to people. So everything from getting your physicals done to diabetes management to medications, behavioral health.
So it's not an urgent care clinic. These are primary care providers.
Correct. We are people's medical homes is what we're looking to be. So kind of, everything that you could need in one space. And then coordinated services planning, which is at the bottom of your screen. It's staffed by social workers. It's a Fairfax County government service, and you call them up and you say, okay, I'm about to lose my home. And then they kind of go through an interview with you about, well, what are your other needs? And they get you linked up to other resources. Now, given that we're in the middle of a pandemic and people are at risk of eviction and that sort of thing, they might be a little bit busy. So definitely pack your patience with them.
So that's the number you call in the event that you are facing potential eviction, behind on rent, need any type of program in the human services world that is offered. Is that what you're saying?
Yes. So utility assistance, I need to know where to go to get medical care. I need to know where to go get child care, that sort of thing. And then they offer a human resource guide that you can go to and also look up those kind of resources. So those are all very, very great resources. And
so it's a central point of entry for reaching out to the county to see what is available for them. It is
correct.
Hence the coordinated services planning name on there. And then you mentioned the human resources guide. Is that a function or a product of the human services community?
Correct. So the things that you can get on the phone, you can also get on the website if the phone is difficult for you.
That's fantastic. That one point of entry, congratulations, Fairfax County, for getting there and being able to, be a switchboard operator and make sure people are receiving all the services that they need, not just, piecemealing one at a time, but also making it accessible for those who might have data disruptions, or lack of internet. Not everything is on a website. So that is really great. And Alexandra, thank you for having us, put those resources on the bottom of the screen. I hope that our viewers can utilize them, share them, take a note, please. I'm going to ask our producer to put that up one more time. Please write down this information. You never know when it's going to come in handy for yourself, for a loved one, for a neighbor, or a complete and total stranger. Please take this information down and save it. That would be really fantastic. And again, Alexandra, thank you for bringing these to our attention to make sure that we are sharing them out there and using this platform to get those resources out there for the broader community. Speaking of resources, other than those three of, community health centers, the human resources guide, and the Fairfax County number, what are some other resources for people who want to get involved in being an activist? What are some things that people should know before they wake up, get out of bed, and say, I want to be an activist today? Where can people go? Can they call you?
Sure, I get called Rolodex. So, a lot of people do call me, and I am that person who people will call and say, okay, I want to do X. Who do you know that does X? And I can link people up. But there's a lot of organizing happening kind of behind the scenes. People aren't being loud about it. One of the things that I got plugged into during the pandemic, but it predates the pandemic, is this concept of mutual aid. Mutual aid is actually started during slavery, and it was a way for Black folks to stay alive and get material resources that they need. And it's also got a bit of political analysis to it. So changing the conditions that would cause someone to need food or need that sort of thing. So there's many mutual aid projects happening all over Northern Virginia, happening in Arlington, in Fairfax, in Prince William.
Is that something somebody can look up, mutual aid projects?
Well, yes, you can look up mutual aid, and it's all over Facebook. It's happening in Alexandria, it's happening in Arlington. So mutual aid is definitely something that I have been very happy to get involved with, because it's different from this charity model. It's a recognition that we are interdependent on each other, and that there will be times when I can offer aid, and there will be times when I need aid. And so I can offer aid when I've got it, and then when I need it, I can also ask for aid and have a community that helps me. One of the things that I would say is get to know your neighbors, get to know what their needs are. There's a lot of shame and a lot of stigma around poverty, around being food insecure, about being housing insecure, that sort of thing. And it's because of the relationships I have with other people. I know who needs what, and then I can try and provide support in a variety of ways. But mutual aid has definitely been something that I've appreciated learning about. And then you provide the direct service, but then you also do the advocacy work to change the conditions that caused people to need mutual aid in the first place.
And mutual aid is not just something that is financial or a physical resource, right? You were mentioning earlier, sometimes one of the best things you can do as an activist is check on other activists and see how they are doing, and just touch base with them. So could that be considered a form of mutual aid? Picking up, calling a phone, and talking to somebody, or is mutual aid a very is it in its own lane, so to speak?
It is different from what you're describing, but mutual aid is not just financial. It's, hey, can somebody come, watch my baby while I go on a job interview? It's, can somebody get me a cup of sugar, so that I can make a birthday cake for somebody? It's, can somebody take me to a doctor's appointment, so that I can be healthy? It's that sort of thing. So it's not just financial. But
some of that sounds like it has to be proactive from the potential recipient, being able to identify and articulate and communicate what their needs are, right? Versus, somebody making an offer, right? Which sometimes might be received in a not so positive light. Well, I don't need your help, right? So this definitely sounds like it's more something that's has to come from the one soliciting.
Well, it really does go both ways, because, for example, I can post to Facebook and say, hey, I've got 10 extra blankets that I was donated. Who needs them? And somebody can pipe up and say, yeah, I could use 10 extra blankets. And again, you don't have to fill out paperwork, and you don't have to prove your need, because a lot of the nonprofit model is prove that you need what you say that you need. And there are limits.
Sometimes that takes 3 months.
Right. Or that you have to prove that there's limits to how much you can ask for. You can only ask for help once every 28 days, or we'll only give you 3 cans of beans, from the food pantry kind of thing. So mutual aid is, I have a need, I can fulfill the need. And it's about building relationships. And so that's very important. But to the point that you were making about checking in on other activists, this is important as community building. And in that checking in on other activists, it's not mutual aid, but you'll find out that another activist's parent is sick. And so how can I support you while you're supporting your parent, and that helps strengthen relationships. It also helps people stay engaged in activism. it's one of those things. Sometimes I go and I do the dangerous protests, and where pepper spray is deployed, and where you risk, you're risking physical harm, and you're risking other kinds of harm. And when
idea for the future, Alex, show idea for the future. I would love to hear your story about going down to Charlottesville.
One day, maybe when I'm ready to tell it. But I cannot do the quote unquote spicy or dangerous work without knowing that, for example, my mom is taken care of. So part of community care, not necessarily mutual aid, is knowing that I've got someone who I can call and be like, okay, I'm going and I'm doing dangerous work. Can you be with my mom so that if something bad happens, you grab mom and come and get me wherever I am, whether it's hospital or somewhere else.
Absolutely. I know family is very important, and, making sure that not only you're checking on your loved ones, but you're making sure that there's a plan. That is, really fantastic. And, also understanding your limits and knowing what is on your personal checklist before you get involved into something. I think that is very important. From what I'm hearing, that a lot of our viewing audience should understand is know your limits, know what you're getting into. Don't be a know-it-all. Learn what we've learned from Alexandra this evening has been, it is okay to learn. And that is one of the things, again, I want you all to learn those websites and that phone number that Alexandra shared with us, so we can make sure that that word is getting out into the community about some of those resources that she mentioned. Alexandra has been a fantastic guest. Thank you for joining us. Do you have any parting words before we wrap up?
Just that, to go off of what you're saying, it's important to take care of ourselves, because from a healthcare perspective, from a disabled perspective, from a activist perspective, we've got to take care of ourselves, because we're building the world we want to live in. And the world we want to live in is one of gentleness and kindness and compassion towards each other. We don't need to wait for that world to be built. We're building it right now as we speak. So how we show up to do the work matters right now.
That is fantastic. Words of wisdom. You heard it here first on the Inside Scoop from our guest, Alexandra Dixon, who is a disabled Latina activist with a passion for healthcare in our community. Alexandra, again, thank you so much for joining. I cannot wait to have you back on this show in the future to talk more about things and kind of give us an update on what has changed since when. So again, thank you so much for joining us, viewers and guests. I'm your host, Morgan Jameson.